The Dee Norton Child Advocacy Center is a safe, child-friendly place for children to turn when there's a concern about abuse. Today, I talk one-on-one with the executive director of the center, Beverly Hutchinson, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Beverly Hutchinson, welcome to Quintin's Close-Ups.
Thank you. Glad to be here.
I appreciate it greatly. Obviously, you're the executive director of the Dee Norton Children Advocacy Center, that is, which is a safe, child-friendly place to turn when there is a concern about abuse here in the Low Country. Let me ask you, what's new, what's now at the center?
What's new and now at the center? I think the thing that feels so good is we're back to normal operations post-COVID. We, like everybody else, faced many, many challenges to continue to offer services to the children and families that need us, to continue to, serve our community partners who need us to do the work. So it is nice to be back to, quote unquote, normal operations.
So how many community partners have actually partnered with you all in the past 6 months?
Past 6 months, we have official agreements with over 30 agencies in the community. Top of mind, social services, law enforcement, and the schools.
So, okay, how many people? I would say, how many clients have you actually taken in thus far?
So, in 2021, we saw a little over 800 children and their families. As compared to pre-pandemic numbers, which was between 1,400 and 1,500 children. So a significant drop during the pandemic.
And when did that drop happen during the pandemic?
Well, pretty much as the pandemic occurred. So we began to work with our community partners shortly after, for us, that was about March of 2022, where we really kind of got the stay home orders. So we quickly had to talk to our community partners and begin to build a triage system. And, that was really where the safety of the child was considered. The children who were at the greatest physical risk were seen first. At the same time, we're continuing to offer phone support where it's available to those families who are having to wait to be seen. Then, of course, we had to figure out how do we continue. One of our key services is a forensic interview, and generally, a forensic interview involves one of our trained staff sitting in a room with a child, one-on-one. Is video recorded, and during the pandemic, of course, there were health reasons that wasn't possible. So we had to begin to think how to do that, and then, of course, the fact that COVID impacted our own staff, and they had health issues, family issues that had to be considered as we're continuing to schedule children and families.
Wow! So, are you all allowing that triage system that you had during the pandemic, that is, to stay in place?
It is being modified as we continue to open back up. So, and we're continuing to look at, were some modifications a good thing? Do we want to, I think like everybody else in the world, what did we learn during the pandemic that might move forward into post-pandemic life? So we're continuing to look at that triage system and assess that, but, still being able to respond more quickly as referrals come.
And how many referrals have been coming in?
Well, we're beginning to see an uptick. One of the questions we've been asked a lot during the pandemic is, have you seen an increase in child abuse? And, the research indicates that when there are additional stress and layered stress, like we saw during the pandemic, that you would expect the incidence of abuse and child trauma to go up. But for us, it's about how many reports do we get in, right? How many referrals do we get from social services, law enforcement? How many parents do we get on the phone? And that did drop during the pandemic because children weren't out and about where they normally are. So a lot of those referrals dropped. So we are beginning to see, especially now that children are back in schools and in a more regular, normal life themselves, we're beginning to see a slight uptick in those referrals. and anticipate that will, and are planning for that to continue.
Oh, so sad. So, okay, when you talk about that triage system, Beverly, what modifications do you want to take place or want to make certain it happens right now?
Well, I think right now we want to make sure that children and families, when there's a concern about child abuse, are seen as quickly as possible. That's always our goal, either in the middle of a pandemic or before the pandemic. So, we are completely returning to that. How quickly can we get this child and family seen? What does this child and family, what services do they need? At the same time, part of the Children's Advocacy Center model is working with those other community partners. We always want to make sure that we're responsive to their needs as well. So trying to make sure that social services and law enforcement get the information they need back from, the part of the process that we're involved in a timely way as well.
And for those people that you can't unfortunately see, what services can your center, that is, provide?
Right. So we have, staff that their job is to sort of support those families until they're seen. So we're going to be talking to them on the phone. We're going to be giving them guidance and support until they are seen, identifying any needs, and sometimes the needs are basic needs. And so how do we connect them to services to help them with their basic needs? So we really do provide, we attempt to provide complete wraparound services for our clients. We don't fill all of those needs, but we partner with other organizations and make referrals where appropriate. So we're able to do a lot of rapport building with the caregivers, and we want them to feel supported and heard as well. We know that the outcomes for children are generally directly related to how their caregiver is managing the trauma as well. So not only are we working with the children, we also believe in supporting the caregivers during this trauma as well.
And have you seen an uptick with that as far as caregivers since the pandemic began?
Not yet. And I think that's very similar to what we talked about with with a referral with the children. We know that parents were more stressed. I mean, there's plenty of reports out in the media about that. And so we, as we're working with the families, one of the things we historically always strive to do is to meet each family where they are when they walk through our door. So what we know now is that a lot of the families, all of the families, we've all been through this shared experience together, right? So we know that. And so how do we acknowledge that and make that part of how we're meeting that family at the door?
And what other models are you using to meet these people where they are?
That's a good question. Tell me a little bit more about what do you mean when you ask me about what other models?
Yes, ma'am. What other models? Let me ask you this. What trends are you seeing right now as far as meeting people where they are when they come to you for these particular needs?
So what trends are we seeing right now? It was interesting. We just did a final report on our 2021 numbers. And one of the things that I noticed is the referrals for sexual abuse were higher than the numbers for physical abuse. And that is a slight shift. It's a slightly higher percentage now for sexual abuse than physical abuse. Now, you ask, is that because there's more sexual abuse? It could be. But it could also be that we're receiving those referrals more often. So, as I mentioned earlier, the forensic interview is one of the first services that we offer. And that is a non-leading, child-friendly interview that creates a safe space for them to tell. With cases of sexual abuse, it is very often the child's word against an adult's word. Whereas with physical abuse, you could possibly have physical, visible evidence to document. So our partners really rely on that interview process with those sexual abuse cases because it is the best opportunity to have the child be able to tell what did or did not happen. And it's video recorded. It becomes part of the investigation. So, when I see that uptick, we begin to ask the question, why, what changed? And we don't have enough data points today to say that. But I know in the past, that is, those cases of sexual abuse, we do see that our partners really, really rely on that interview process as a key part of the investigation.
And I know on your website, you said that we believe that child abuse does not define who a child is or the person they are destined to be. So how do you define child abuse in general?
Well, for us, we operate with the legal statute of child abuse, and don't ask me to quote it word for word. So that's the parameters within what we offer. But I will tell you, as we've been here for over 30 years in the community, serving children and families and our community partners. And, as we have built a community of trust in that, we do see that our partners are recognizing that there is child abuse, and they rely on those partnerships. We work together collaboratively on that. But we're also seeing that they're looking to us to do some of those forensic interviews for other types of child trauma. So maybe a child has witnessed a violent crime, and and law enforcement goes, oh, wait a minute, Dee Norton knows how to do these interviews. We want the best opportunity for this child to feel comfortable, safe, protected, and be able to just tell what's happened. So, we really feel honored that law enforcement comes back to us in those occasions and asks for our help in that way.
And I wanted to ask you this because it's also on your website, but it says it can be overcome, but it takes all of us together working as one. How are children in the Low Country overcoming this abuse by working as one?
So, I'll reflect a moment on our mission statement, which is three-pronged: prevent, protect, and heal. So prevent, that's all of us. That's each and every one of us in our community, all of the adults in the community, learning, using the tools. You've heard the phrase, see something, say something. It's all of us working together to provide the safest environment we can for the children in our community. So Dee Norton is actively doing more work around primary prevention, providing tools, providing tip sheets. You probably saw on our website some tip sheets on how to prevent abuse, beginning to do more and more of that, trying to make sure that all adults have what they need to prevent abuse. And then protect and heal. We fully want to support the investigative process, but we also recognize that for the child and that family, they may need more than just a closed investigation. They may need mental health services. Yeah. And one of the things that we know very clearly post-pandemic is the mental health welfare of our children has declined during the pandemic. And mental health resources are scarce. So that just compounds a really significant problem. And Charleston's not unique in that. This is a national issue around the mental health needs of our children. So, that's where that whole healing, and we do believe that children can assimilate this trauma into a healthy, productive life. If we didn't, we wouldn't get up every day, right? We wouldn't show up. We do believe that, and we see it. We're fortunate to see it. If you were here in our lobby and you saw children in our lobby, you would see children playing, laughing, coloring, talking, playing, video games. Yeah. They look just like every child. And all they want is to continue to operate in that space, right? They just want to be kids. Right. They want to unload this burden on the adults, and they want to go back and play video games with the Barbie car. There's a story we tell about a child, and this de-identified. We protect the child, confidentiality. So when I share this story, it's a composite story where we've de-identified. But there was a child who came to us, teenager, concerned about abuse within the home. During her forensic interview, she gave really credible information that helped law enforcement act and remove the alleged perpetrator from the home. So we call her Samantha. Samantha was now safe, right? She's physically safe, and that is a great thing. But Samantha came back to Dee Norton and told her therapist, "You got him out of my house. Now, would you get him out of my head?" So for us, that's the goal line for us. We want to help that child get this out of their head, learn how to manage those emotions around the trauma. And it's just a privilege to do that work every day. You know, I can remember one time sharing with a supporter how many children we saw one year, and their response was, "Oh, that's so sad. That makes me so sad." Our response is, those are the lucky kids. There are children out there who aren't getting services. Those are the children we worry about. And that's where the whole community is so important, to circle back to your question. If we create a protective, safe community, then when abuse does occur, we want every child to be able to tell, and we want every family to know what to do.
Yes, absolutely. So, okay, Ms. Beverly, let me ask you, how many of those children are not really getting the services right now that they really need here in the Tri-County?
So we do a lot of our programmatic team really relies on data. Oh, yes. So if you look at we use the child population. The national statistics of child population tell us about 11,000 children in Charleston, Berkeley counties will be abused in any given year. National statistics tell us about 40% of those children will even tell during childhood. So you do the math, you coming on down. So, you know, something somewhere around, I can't do that math.
I know.
I'll be honest. I'm not a mathematician. But if you know that we're in our best year seeing, you know, about 1,400 of those children, there's still a significant number of children that we know we're not seeing. Somewhere probably in the neighborhood of about another 1,000 to 1,200 children. And we know our community is growing.
I was going to.
And so, you know, as our child population grows, and you take those same statistics, those numbers grow. Now, we were right before the pandemic. Dee Norton completed an expansion project, a physical expansion project. So, up until around 2015, we identified that we were hard pressed to see more children because we physically did not have the space. So we completed a capital campaign, and we, in 2018, opened a second full-service center, which is where I am today, east of the Cooper. And we also renovated and then reopened the King Street Center, which is our original location, in 2019. So for 6 whole months, we were in 2 locations.
Yes.
So when you ask what's new and different post-pandemic, well, we're relearning how to operate in 2 locations. The good news for our community is we do have that physical space now to see more and serve more children. And so now we're focused on building the internal resources so that we can begin to serve more and more children. Primary prevention and raising awareness, we believe, will help create an environment where children feel safe to tell, and really begin to address that issue of the number of children who are not currently receiving the services they need, and improving that.
And of course, I know about the King Street location, born and raised and growing up here in Charleston. And I think I dropped off some food there for you all for our restaurant a couple of years ago, prior to the COVID.
Right.
But I was wondering, what other internal resources do you need right now?
Internal resources, you know, to do the work. We're a human services organization, right? People need to see more people. So in order to serve more children, we need more staff. You know, so that's the simplest answer to your question is, what do we need right now? And as you add more direct service staff, of course, then you need more wraparound, you know, support internally, administrative. You know, we need, you know, that means you need more funds. We are a nonprofit.
Right.
My husband, who is a banker, once reminded me that just because we see more children, it does not increase our revenue. Mm. We do not charge for any of our services. We want every child, regardless of their economic ability to pay, to have these high quality services, these evidence-based services. We believe that every child and family deserve it. So let's just remove that barrier. Whether a family can pay or not, we'll just remove that barrier. So seeing more children means we have to raise more funds. And, fortunately, we live in a very generous community. We also actively seek grants, competitive federal grants, state, private foundations, all to support, as any nonprofit does, all to support the mission of prevent, protect, and heal.
Yes. And this might be a redundant question, Ms. Beverly, but how do you all keep up with this growth with smart growth?
We do a lot of strategic planning. We just, as a matter of fact, completed a new strategic plan. Okay. It's an 18 to 24 month plan. We met for over a period of about 6 months. We, being our leadership team, met. Some of our board members were part of that process, and we really identified the work that we want to make a priority in the next 18 to 24 months. There's so much work in this space to be done, and so it's our responsibility to, really prioritize that work and then to find the resources we need to accomplish it.
Yes, ma'am. And let me ask you this: what area? Okay. I know it's basic, it's obvious, but what age demographics have you all helped out the most?
Well, I will tell you that statistically, the largest percentage of children fall within a 7 to 12-year-old range, okay, followed by teens, and then 0 to 6. Right. So we see children being 0 to 18, but about 45% of the children we see fall in that 7 to 12-year-old range.
And how many of the clients have you helped are according to their age, or their gender, I should say?
So gender is about 45% male, 56 female, and then documented, and this is an area that we are doing some improvement on, like 0.4% transgender. We recognize that's an area of inclusiveness that we can improve, how we meet families where they are. How do we meet transgender youth in a more compassionate, respectful way? So we are actively looking at how can we integrate some policies, procedures to make this a safe place for all children.
And that was my question. I was thinking about it mentally, but have you seen an uptick with that? As far as transgender, clients?
There again, it's chicken and egg. Is it an uptick, or is our community a safer place for children to identify? Mm. That's a hard thing to know for a fact. I suspect that we are creating a safer environment for all children, regardless of their gender identity. But how do we begin to acknowledge that is a reality in any youth's life, and how do we improve our service delivery with that knowledge?
Yes, ma'am. And what policies would be ideal right now?
We're actively talking about it about how do we make this a safer space for LGBTQ. We're looking at one little small thing that we're investigating is a card in the lobby that a child could pick up and self-identify and hand to any of our staff. That's a simple procedure, but for us, we believe we have to do a lot of pre-work before we introduce that card, because if we ask that child that information, what are we going to do with it? How are we going to document it? How do we make sure our staff respond in a really appropriate manner? So we're going to do some training of our staff we're about to launch some training around, that topic for our staff before we ever introduce that card into the lobby. Because what we don't want to do is to ask for that information and then not honor it. Ask that same child the next time they come in to identify themselves again. That is not respectful. So how do we use that information in a very respectful, compassionate way? Compassion, collaboration, and commitment to excellence are our core values. And so every time we look at an issue, those innately come out.
Yes, ma'am. Sorry about the delay there. Yep. So much noise out here. So sorry about that. But let me ask you, how many children in the Low Country actually experience child sexual abuse before their 18th birthday?
I believe the national statistic is 1 in 6, but I would ask you to fact check me on that because I know that has changed somewhat. And it's a little bit different boys to girls. Girls are slightly higher than boys.
Oh.
Too many.
Yeah. Yeah. How many child victims, Miss Beverly, actually disclose the fact that they have actually been sexually abused?
National statistic, sexual abuse. I'm not going to be able to break that one down for you specifically. Nationally, sexual abuse is not the most preferred type of abuse. It generally probably is neglect, to be honest. But that's another issue, right? That's generally related to poverty. Then physical abuse, then sexual abuse, domestic violence. And we see all types of abuse. And the other thing that we know is that very often different typologies coexist. So I think it's so interesting when we do some of this statistical work. A child may be referred for physical abuse, but during the course of the interview, they may disclose other typologies of abuse. Maybe there's domestic violence in the home. Maybe there's substance and alcohol abuse in the home. Maybe there's sexual abuse that goes along with the physical abuse. And, we want to address all of those. And make sure that the child and the family receive all of the resources they need.
And what percentage of children tell someone within their first year here in the Low Country?
I'm sorry, say that again.
Yeah, what percentage of children actually tell someone within their first year, say for instance here in the Low Country? I can't tell you that
within the first year. We know that only about 40% of children tell during childhood. It's and that's a percentage we'd love to see, be reduced, go away. We would like that world, I dream of that world where first it doesn't happen,
right? But
in the event that that is not possible, and which I do not believe, I don't know that it is, there's a fair amount of research now that shows primary prevention does work. It actually does help reduce the incidence of abuse. And then we always want parents to know what to do if it does occur. And to have the confidence that there are resources in our community to help them through it, and to understand that we can help their child and the family assimilate this trauma.
And this, I hate to even ask this question, Ms. Beverly, but how many child pornography victims are living at home when they're actually photographed?
More than you would want to know. Likewise, we have become, and we have seen an uptick in this during the pandemic, child sex trafficking, which pornography falls under. That's part of that typology of abuse. And people say, I think generally in the public, I have heard that happens here in Charleston. I think the common notion was it happened in big cities where young girls were brought in, where there's a big sporting event. No, it happens right here, and there's kind of a domestic version of that, right? So that's where it happens within a home, where a child is sex trafficked in the home or even outside the home. Children who are truant, who are runaways, are at high risk to be trafficked. And and I'm really glad that we've become part of the response to that, to help, remove those youth from that environment. And it's heartbreaking, but so happy to be part of the response.
And how many of those children receiving an investigation or an alternative response from the Child Protective Services?
I'm sorry, ask me that one more time.
Oh, yes, ma'am. And how many of those children actually receive an investigation or an alternative response from the Child Protective Services?
Well, I mean, I'm trying to think how to answer that question. I won't be able to give you a percentage. I'll talk about the response. So, that's law enforcement and social services working together if it's in the home.
Okay.
And we are, we would be the preferred response. Dee Norton would be when law enforcement and social services have a concern about child sex trafficking. That's where those partnerships are so critical. So as our community has begun to change how we view this, so a 15-year-old prostitute is not, a child cannot choose that life. So that is a 15-year-old who is being trafficked for sex. So as we, as agencies working in this field, see that child differently, our response is improved. You know more, you do better. Being able to now see that 15-year-old, 14-year-old, 12-year-old who is being trafficked for sex as a victim is very important to us beginning to really change how we react and how we respond and how we provide services. And that transition is happening here in our community.
And let me ask you too, Beverly, because you mentioned this earlier with poverty abuse, but what age group is the most vulnerable to, say, maltreatment?
See, any child? You said child maltreatment, so
yes,
the
ma'am.
Possibility of abuse. It happens to all children. When we we're doing the due diligence to open a new location, we really looked at our service delivery numbers in different areas of our service area, which is Charleston County, and then we share service delivery in Berkeley County with a center like ours in Somerville.
Okay.
So, who are we serving and how? And so we really look at typologies of abuse that cut across socioeconomic status. And that would be physical abuse, sexual assault, domestic violence. We know the incidence of those typologies of abuse do not change based on socioeconomic status. So obviously I'm leaving out the maltreatment there. And it happens, in all of, it doesn't matter if you're Black or if you're white or if you're rich or you're poor or you finished college or you didn't, it can happen. And what we found when we were doing that due diligence is we weren't seeing as many children from the East Cooper area. They were not receiving services at Dee Norton with the same frequency as children in other areas of the community, which is why we ended up over here. Right. But to your question about who does this happen to and how widespread it is, it is, all of our children can be at risk. That's kind of the scary part. The good news is, prevention works. We want to make sure that our parents, our caregivers, our teachers know, what we need to be doing. What are the questions we need to be asking? What are places that aren't safe for our children? How do we deal with social media? How do we deal with the internet? I think there are challenges. My children are grown. Thank goodness. The challenges of just social media and access on the internet is a whole nother level for parents and caregivers, any adult who's involved with children, to be aware of. It is a very good tool, and we want to have good parameters around how our children use it and where they go. One of my staff was talking to me about, I was asking them, she works with a lot of our youth. I said, how do you, what would you tell a caregiver? What do you tell caregivers around how to protect their kids, their exposure on the internet? through social media, through game playing. And she said, you know, what I generally tell parents is to look at their online environment the same way you do their physical environment. If your child was going to spend the night at somebody's house, you would know where that house was located. You would know the name of the people there. You would know this child. You would know these parents.
Yes.
So you want to talk to your child about having those same sort of boundaries. So you talk about your family values. Our family values say this, and that applies whether you're online or you're playing out in the neighborhood.
Yeah.
Which I thought was, for me as a parent, that was very practical, right? I could do that. It felt very empowering. So I think when we think, oh, this is so scary, oh, no way. You have all the tools you need. Just apply them uniformly.
Yes, yes, indeed. And let me ask you this. What type of concerns are on the horizon that you see right now that you really want to tackle before it becomes a problem?
Right. I think continued education, around prevention. You know, we want it not to happen. I also want, you know, I would love to see people begin to view this as not something that should be talked about quietly and behind closed doors. No child asked for this. It is not a child's fault. You know, when I talk out in the community and I do presentations, I often use medical analogies. You know, if my child had a heart condition, I would seek out the best medical care I could. You know, I'd go to the children's hospital. I'd find a pediatric cardiologist that is just the top in his field, right? And I would, you know, and my friends would know my child was going through this, and they would support me. And the community would wrap their arms around me and say, "We want your child to get better." I want that for every child who experiences child abuse. I don't want it to be, you know, you're not broken. You know, you're not damaged goods. A bad thing happened. And together we're going to help you get through it.
Absolutely.
That's the dream world I live in.
Yeah, absolutely. And we thank you all for your great work at Dee Norton, by the way. We really appreciate it. The community appreciates it.
Well, it is truly an honor and a privilege to work with the families who trust us enough to come to us with really hard stories, and then trust us to stand alongside them and to help walk with them through this.
Indeed, absolutely. Well, Beverly Hutchinson with the Dee Norton Children's Advocacy Center. I'm tired of it.
It's hard to say.
Oh, Jesus. But thank you for your time here on Quintin's Full Steps, and I hope to get you back on in the future, and hopefully you can do it in person or Zoom again.
Would love that. Quintin, I appreciate your taking the time to put this information out there. And, you know, the more we talk about it, the less of a taboo it becomes. So thank you for being part of the solution.
Oh, you're welcome. Anytime.